Hey, good afternoon. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. Thank you for joining me today for our Facebook Live broadcast. And today we're going to talk the usual stuff, which is about COVID and the latest here in our area, our state, our country, and the world. And I'm going to start, we'll do the usual facts and then some news information, and then some analysis about all that. So first of all, facts. I'm going to have Matt put up our visuals. Thanks, Matt. So you can see the top left there is the number of cases last week, which I don't have my glasses on, but I think it was 163. And the week before that was, I think it says 73. And then you can see the bottom left is the 2 weeks one. So 2 weeks, the last 2 weeks, how many cases, and then the blue is how many there were in the 2 weeks prior to that. So I think last week when we showed you these, it was looking like we maybe had kind of peaked in terms of our cases, but obviously, at least as of Monday, we had more cases that week than the week prior to that. So kind of sobering that we're not quite there yet. Hopefully next week, but the numbers are going to be what the numbers are going to be in terms of that. And then if you'll notice too that it's under 20 where you have your biggest number of cases, and I think that goes to schools in session and those type of things. And so when you have that, we're getting more cases, and so it's a indication of need for those folks who are 12 plus who are able to be vaccinated to get vaccinated, because oftentimes those younger folks are the ones that interact with people that are in the other age categories, and then that can lead to their positivity. So that's why it's important to get those folks vaccinated too. So yeah, that's kind of our numbers. And then on the right there, that's a particular day. That was yesterday. You could see the case count, the percent positivity. Just crept up a little bit the last week or so in our county. So yeah, that's our numbers. And then the bottom right is just kind of a visual going back to, I think that's January. And you can kind of see some peaks. That January one, we were able to go left, we go much higher even in December and November in terms of number of cases. And you see our spring peak, and then we're having this peak now. And one of the things that I've talked about in previous broadcasts is that when you see our case peak in the community, the peak in the hospital tends to lag that by about 4 weeks. So from the hospital standpoint, I see these numbers this past week and I go, okay, so it's pretty likely that our case numbers, which have already gone up some compared to where we were at even a month ago, that those numbers are probably going to go up more based upon what we're seeing in terms of the cases in the community. So other facts I wanted to share, and that was kind of comparing 1918 to 2020 in terms of the pandemic. Part of the reason that made me want to share that fact with you, Matt, did I forget a couple? I did forget a couple. Let's put a couple more graphs up. My mind went in the wrong direction there. So yeah, this is what I get every day, but I just wanted to show you like I did last week. So 3561 new confirmed and probable cases, including 39 additional deaths. This is for Illinois from the Department of Public Health. Second paragraph, 28 individuals in the hospital with COVID, 494 in the ICU, and 262 were on ventilators. And then the positivity rate statewide was 3.9%, which is trending better, but obviously our particular area is not. And vaccine administration, 19,494 doses. So people are still getting vaccinated, which is good, not as high as it was. You'll see 63.2% of Illinois adults, that's 18 plus, have had fully vaccinated, and 80.6% at least one vaccination. And then on the right there for the U.S., 7-day moving average of 130,000 cases, and now we're at 675,071 deaths. with a daily increase of 1,334. So the cases nationwide are going down some. That's mainly because Florida and Texas are going down because they had, I think, what was it, 20% of the cases at one point in time. But there are pockets like here in the upper Midwest where the case numbers in some places are going up some. So anyhow, that's that. And the 675 deaths, the reason I bring that up is that the folks who do these estimates estimate that's about how many people who passed away from in 1918 in that flu pandemic. So we're at that number right now. What's the last graph I wanted to show everyone, Matt? Okay, so this is the average deaths in the U.S. by cause. And you can see that heart disease on that top blue line tends to run, somewhere in that 2,000 to 1,800 range. Cancer tends to run about 1,600. These are daily deaths in our country. And you see COVID's numbers in August. Well, our COVID numbers now are, depending upon which day you get it, are somewhere in that, right now, our daily case number is somewhere in that 1,900 to 2,000. The last one I saw was 1,947 a day, so right now, COVID probably is the number one cause of death in our country, or it's right there with heart disease, which is pretty sobering when you think about that COVID is, with the vaccinations that we have available to us, is not entirely, but pretty preventable cause of death. And it's mainly the 71 million adult Americans who are not vaccinated who are getting sick and dying from COVID, which is just a shame. So thanks, Matt, for showing that. And what I wanted to do facts-wise was just compare 1918 and that pandemic and 2020. I mentioned that the number of deaths is pretty similar, but you keep in mind, though, that the population was different at that point in time. So in 1918, some differences that equated to 1 in 150 people died from that pandemic, whereas right now we're at 1 in 500. Of course, that number is rising, so that 1 in 500 number is going to only go down, but there's definitely a difference based upon the population sizes. 1918 tended to be a younger group of people that died from that influenza versus older in our pandemic, although obviously that number is starting to go down because of this whole group of unvaccinated folks who are getting Delta. The percent of people that died from it was about 2.3 in 1918. It's about 1.6 now for what I'm reading. Now, was that because that strain of influenza was more deadly? Maybe, but also keep in mind that our healthcare, what we can do for folks is definitely much more advanced than what we were able to do in 1918, and there's been advances in public health as well. So anyhow, and then the 1918 pandemic basically lasted for a year, where this one has lasted for a year and a half and going. And the most deadly month for the 1918 one was actually pretty shortly after it started. It was October of 1918, whereas so far our most deadly month was almost a year after it started in the U.S. It was January of 2021. Other facts. Hospitalizations that I mentioned at CGH are definitely rising, and we're definitely seeing, there's definitely some older patients here that have COVID, but definitely seeing a trend towards folks who are younger that are getting sick and being hospitalized. So news-wise, I'm a few things that I thought were, if you haven't had a chance to read the news, I'm going to catch you up on what I thought was pertinent this past week. The U.S. is providing 500 million vaccine doses to the rest of the world. That's good. There is monoclonal antibody supply. This is a very local piece of news, but it's local but not. So you've probably heard of monoclonal antibodies, and they are a treatment that people can get if, number one, if they are symptomatic, if they have COVID and are symptomatic and are high risk, before they're hospitalized, they can get monoclonal antibodies, and those monoclonal antibodies help to keep people from getting sicker. And also the category now, people that are high risk who get exposed to someone who has COVID can get those monoclonal antibodies as well, which is good because it helps to keep those people out of the hospital. However, the supply of those are becoming more scarce. So our supply at the hospital here is getting very low, which flows into the U.S. shortage. And the federal government in the past week or two took over distribution of that particular therapy. And so I guess I'm just saying that, yeah, our supply used to be like, if you needed it, you can get it here. And that's still the case, but there's no guarantees that monoclonal antibody is going to be available all the time at the time being. So it may go from day to day or week to week in terms of our ability to give that out here at the hospital. Just wanted folks to be aware of that. And I guess the only reason one of the reasons I bring that up is if though there are those out there whose strategy is to not get vaccinated and just do the monoclonal antibody if they get sick, I don't think that's necessarily, for many reasons, that's not a good idea, but particularly in that the monoclonal antibody may be a bit more hit and miss in terms of its availability. That should drive those folks towards vaccination if possible. Most all of you probably have seen this FDA approval of the Pfizer booster shot, and that was for 65 plus year olds, 18 plus year olds who are at high risk, healthcare workers, teachers, grocery store workers, prisoners, and those in homeless shelters are the categories I saw. Now, granted, the CDC is meeting today to discuss that further, to take the approval has been given by the FDA, so it can be given. And now the CDC is making recommendations about, from their standpoint, who it should be given to if they would alter that at all. And then, of course, the federal government is involved with getting those out to people and all that kind of stuff. So, boy, it's sure trending in the direction of there's going to be a group of folks who are going to be recommended to get those booster shots. And I think right now there's definitely some debate for the non-high risk people about the data is still coming in. And so I think that's what's making for non-high risk people the decision about getting a booster or not, I think is going to evolve based upon that data. Another piece of news that I saw just today that I think is going to be interesting to follow is there was a study done in, gosh, I'm forgetting the country. It was over in Europe, and I think it may have just been a European study, and they were giving patients inhaled budesonide, which is an inhaled steroid, like people that have asthma take that kind of medicine. And giving that to patients early in the course of their COVID decreased their need for urgent care kind of needs, so getting sicker. It seemed to be of benefit to them. So it's not a recommendation yet here in the U.S., but it'll be interesting to see how that trends in terms of whether that becomes more of another option that doctors have to treat patients who get early symptoms of COVID. There also was a piece of news that came out that said that the U.S. is likely to miss a big winter COVID surge. This is based upon some analyst models and their predictions. That's based upon increased childhood vaccinations. Their modeling shows 140,000 cases or so now a day, going down to 9,000 in March, and the number of deaths we have now going down to 100. But I read that and I'm like, well, that would sure be nice. That would be awesome. However, and I'm going to have Matt put up our graph that we've shown before. Keep in mind that all those analyst models have these things that they're trying to figure out, and So natural immunity are people that have been exposed, have gotten sick, and have some natural immunity just based upon that. Vaccination, of course, helps to keep people from getting sick because, once again, it's an artificial way of stimulating your body to make it to have immunity. And then on the other side, you have variants. Right now, Delta is 99% of the cases in our country. But we don't know what other variants might come to the forefront, if any, because that would definitely change those models. And then, of course, behavior and how we go about living our lives has a bearing on whether or not, so vaccination rates, and then, of course, behavior, which kind of is part of that is vaccination rates, but just do people follow recommendations to try to keep everyone as healthy as possible? So those models are encouraging, but they can go different directions based upon these variables here. And I just want people to be aware of that. Thanks, Matt. Other news, you may have seen that the Johnson & Johnson vaccine, that when people got a booster shot for the J&J shot, that their risk of getting mild to severe COVID disease goes from 74% to 94%. So I think it'd be interesting over time whether the FDA, I wouldn't be surprised if the FDA approves some type of booster for some patients who have had the J&J shot in the past. Other news, vaccinated, I saw a study with vaccinated pregnant women. So women who were vaccinated when they were pregnant, they looked at their newborns and found that the newborns had protective antibodies to COVID once they were born. So the vaccine for the mom actually helped protect the baby when the baby was born. So I thought that was really encouraging and just another piece of information that I hope drives women who are pregnant to consider getting the vaccine. One other piece of news that's more local, I just wanted to, folks, even though we're having more cases and even though the hospital is busier with COVID cases, the hospital is still business as usual in our hospital and our clinics in terms of taking for non-COVID patients and non-COVID issues. We're still able to accommodate all of our elective surgeries, doctor visits, all the screening and testing that people continue to need for their ongoing health care. That's all going smoothly. That's all still happening. So I want folks to realize that, yes, there are things happening on the COVID front, but here at the hospital, we are still able to do business as usual and take care of people at business as usual for their other non-COVID issues. Okay, so my question section today is just kind of the thing that's been percolating around for me is just this whole booster thing and, kind of questions about, so what is, and this is what the FDA and CDC are thinking about and trying to use the data to come up with answers about is, what's the goal of vaccination? Is it to reduce hospitalization, or is it just to prevent the disease in the first place? So that has a bearing in terms of what is recommended in terms of boosters. And will there be recommendations to do any mixing and matching? So if you had a J&J booster, getting a Pfizer booster, or Moderna and Pfizer, and all those type of things. And how much? Linda's asking if I have a J&J vaccine. If I've had a J&J vaccine, can I get this vaccine since I have cancer? So, you already had the J. I'm reading this, Linda, that you already had the J&J vaccine. And then, if your question is, can you get the Pfizer vaccine? Right now, I think the answer would be, from what I'm reading, not right now. More studies are still being done about that. And then also, I think not right now, but I think I wouldn't be surprised if at some point in time that a J&J booster will be recommended. So anyhow, not right now, I guess is a short answer to your question, Linda. Yeah, and then I think on the monoclonal antibody side of things, now that there's going to be less supply of that, for those patients who would normally be willing to take that monoclonal antibody and now are maybe not be able to all the time, what's that going to do to hospitalization rates, not just here, but across the country? Okay, so, and Rebecca, I think we may have had some yeah, here we go. So since the vaccine has been in place, we have new variants to this virus, much like the flu. Does the vaccine cause variants? Yeah, so the vaccine does not cause variants. Actually, even the flu vaccine does not cause variants. What happens is actually the fewer cases of COVID that occur, the less likely that there are to be variants, because variants occur when a host, i.e. a person, gets COVID and that virus replicates inside their body. And every time that it gets into a new host and replicates, it can mutate. And that mutation, if it's, millions and I don't know, trillions of mutations and, millions of people, causes some of those mutations, the virus find to be, it helps them to replicate and spread easier, thus Delta. So no, actually the vaccines do not cause that. They help to prevent that, because if you don't get the virus in the first place, then you're not going to get spread of new variants, which is why it's so important to get, one of the reasons that it's really important to get as many people in the world vaccinated as possible to reduce the cases, to reduce the variants. Good question. What else do we have? Okay. Will the hospital have the Pfizer vaccine available? And will we need an appointment once we get final word from the CDC and the government? First of all, last I heard, it is already available at retail pharmacies, and I think at the health department. As far as CGH, right now what we have a few more J&J shots, and then we have Moderna that we're giving at our clinic, vaccine clinic, that we still have every day, Monday through Friday at the main clinic. I think we're going to have a conversation about that, and more information probably if it gets approved, I would guess by next week I'd have some more information about if and when the hospital is going to be doing some Pfizer vaccinations and how that's going to be done. So don't have answers for you in terms of the hospital. I do think around in the community there are going to be options to get that Pfizer vaccine as well. Good. And yeah, any other questions, please fire my way. Okay, thanks. All right. So here's some other just analysis of all this information. I do think, and I'm support, not that I'm the CDC or someone who knows all the data like the CDC and FDA has access to, but getting the booster shot to people who are high risk, I do think makes sense, and I am supportive of that. So that's my opinion. My opinion is I just think it's sad that we have ample access to vaccinations here in our country, and to have so many preventable hospitalization and deaths it's sobering and it's sad. And, I just encourage folks, it's okay to rethink that. And it's okay if you've kind of been someone who has just had, for whatever reason, has just been on the edge and has just not wanted to do the vaccine. I don't think it's too late to get one. So I'd encourage folks to still consider getting vaccinated for this. What flows from that, we have a large number of people dying every day from COVID, whether that number is 1,500, 1,900, 2,000, somewhere in that range are dying every day right now from COVID. That is, I am certain, absolutely certain, that is way, 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 how many ways can I say it, more risky to get COVID than it is to get vaccinated. And not just the short-term effects of vaccination, but I'm sorry, there are no long-term effects of vaccination that are going to result in this many people first of all, I'm not convinced there are any long-term side effects from vaccination, but even if there were, the likelihood that that is going to be more than all the people that are dying from COVID, I just don't think that's accurate. I don't think there's any chance of that. So please get vaccinated. Other just recommendations, as always, just try to continue living your life, though. Just do it smartly. When you're indoors, wear a mask, get vaccinated, and get the booster if you're eligible for it. Social distance as much as possible. I reiterate my hope and encouragement that you take care of your mental health, your physical health. If you have any concerning symptoms, not COVID symptoms, of course, go and seek out care for COVID symptoms, but other symptoms that you're having, abdominal pain, if you're losing weight, whatever, see your physician for those concerns. Don't sit on those. Don't wait. And what I also would just encourage you to do is if you're due for your screening mammogram or colonoscopy or any other vaccinations that you're supposed to get, go ahead and get them. Keep that going. Don't not do those things because of what's going on here with this pandemic. And finally, Stephanie said, how do they know people are getting which type of variant if they only test for COVID? And why does Delta need to be tested only by the state? So let me try to tease that out, Stephanie. Which type of variant only test for COVID? So when we do a test for COVID here at the hospital, that test is able to, it doesn't discriminate between Delta or Alpha or any other variant of COVID, but it is able to tell that it's COVID. It's broad enough in its ability to know what it's testing that it would pick up anything on that COVID spectrum of variants, whether you're positive or not. And then to your question of, Delta versus other variants, what happens is that is being done. They're doing sampling of, and that's been going on for a long time. They're doing sampling of positive tests, not just in our state, but throughout the country, and actually throughout the world in different labs. So you can't. It's not practical to do a confirmatory test of the variant for every test that's done. There's just not the manpower, the cost, everything to make that happen. But a sampling is done in every state and across the world. And right now, when they do those samples, 99+% of them are Delta. So that's how we're, I guess there's a 1% or less than 1% chance that someone who has COVID right now in our community has a different variant. Yeah, okay. But 99 out of 100 or more are Delta. And the other part of that, Stephanie, is it really doesn't change the treatment or the quarantine or the isolation or any of those kind of things. That doesn't change regardless of the variant that you have. So the variants are helpful to know just in terms of thinking about being aware of them and whether others are coming our way, because then we'd have to know that there might be some other waves. Just like we knew with that, began to know with that Delta over time, that, okay, it looks like in other places it's really taken off and it's going to be happening here, which it has. So that's why we do the variant testing. It doesn't change how we take care of people. But I do appreciate the question. Marianne, flu shots are coming. How long do we have to wait between a booster and a flu shot? Yeah, that's another good question. What I'm reading so far is that you don't have to wait, and actually you can get both at once. So I think we're going to get some more information about that. But yeah, I'm just going to say I think you can get them at separate times, but I'm not for sure of that right now. I'm going to have our marketing folks remind me to answer that question next week as well, and I can look into that a little bit more. Short answer, I think you can get both, and I know you can get them both at the same time. I'm not sure if there has to be any different distance between when you get the COVID booster and the flu booster. I doubt it, but I'll check. Thanks for that question. What do you say to people that keep saying it's not a vaccine, it's just a shot? Are mRNA vaccines a new form of vaccine we'll see in the future for other viruses? Yeah, it's so a vaccine. Yeah, it is not just a shot. A shot would be. I think of a shot as something that has medicine in it. Yeah, it is a shot, but it's a shot that has a vaccine in it. So you can also have a shot that has medicine in it. Say, for instance, if someone has they have nausea, I can give them a shot of something called Zofran that helps to reduce their nausea. If they have an infection, I can give them a shot of an antibiotic to help get rid of the infection. And that's medicine that we can give people. So yes, it's a shot, but it's a shot that actually happens to have vaccine in it. And what vaccines are shots that have they different ways to stimulate our body's natural immune system to produce antibodies, which then help us to fight off infection. Would you put that question up one more time, Matt or Rebecca? And then, our mRNA vaccines, a new form of vaccine that we will see in the future for other viruses. Yeah, it's a newer form. I mean, newer in that I think I don't know. It's been, don't quote me on it, but it's been, I think, several, 1, 2, 3 decades that the technology for mRNA vaccinations has been worked on. And yes, I do think that we're going to see more mRNA vaccines in the future. It is a lot of, first of all, you can flex and adjust them much easier than the older flu vaccine type of products that we still get. But those, like for a flu vaccine, they had to, that's like they do their analysis and try their best to see what they think what variant of flu is going to happen that season. But they're making that decision months beforehand because it takes so long to produce them. So yeah, I do think mRNAs, and it's not going to just be, it's not just in vaccines that mRNA is coming to the forefront as a way to help people out. Just remember that, we are now using our immune systems now to help fight cancer. So, like an example is there is an immune drug that is used for people who have advanced melanoma, and that it's stimulating. It's a medicine that stimulates the immune system to produce what we're talking about here, but they're antibodies to fight the tumor. And so it's happening now, not just in COVID. And, multiple people are getting these treatments that are helping them to live longer. And people that would have, with melanoma, for instance, that would have just a few months are going quite a long time. I don't know if he's still alive, but like former President Carter has melanoma, and he's been on one of those kind of drugs for, gosh, it seems like several years. So anyhow, good question. And yeah, that technology is out there and being used more and more. Thank you for the questions. Thank you for listening. And I'll leave you with this. I would just encourage you to stay away from things that make you sad, that make you frown, that make you feel like you're suffering or anxious. Keep those things to a minimum, to the extent you're able to. And then secondly, do as many things as possible that make you happy. And I guess I have another question here. Lynn, very curious as to the skewed numbers on deaths. I don't understand how a death certificate can read COVID-19 when clearly it wasn't. Auto accident, cancer. Very disheartening to think any facility would obtain dollars for death. Okay. So I'm going to try my best to tease that out, Lynn. A death certificate and what it says, and what a doctor feels a patient died from in terms of the death certificate. We don't get paid based upon death certificates. First of all, second of all, we aren't making money on COVID patients, from my understanding. And at least last I saw, the government does pay extra for COVID admissions. But keep in mind that our COVID patients are in the hospital on average far longer than your typical pneumonia patient is in the hospital. And so our costs are also higher. So I'm not seeing it that way. Now, as far as this idea that the deaths are inflated, or that other things, or people have other conditions when they pass away, for what I've seen of the patients I've taken care of and the patients that I'm aware of that have been in our hospital throughout this pandemic, there are some who have cancer or who have other issues, but I'm really comfortable saying that they wouldn't be in the hospital and they wouldn't die in the hospital. They're not dying because of their cancer. They're dying because they got this virus. And then there are a lot of other patients that I've seen who don't have cancer and don't have other issues, but they're still dying from this virus. And we can quibble's not the word, but we can see differently in terms of the numbers, whether we think it's 675,000 and growing, or 575 or 500,000 and growing. I tend to believe those numbers, but needless to say, right now with a vaccine and the fact that the vast majority of any deaths that are occurring from COVID are preventable, anyone that passes away from it, I feel bad. I feel sad about that. So anyhow, thanks for the question. And okay, so Jason's asking, why would anyone need a vaccine for a virus that 99% of people are just fine? Yeah, that's a good question. So it's not, it depends on there's a lot of variability on that, Jason. First of all, I think the number that are fine is probably higher than 0.3%. It's probably in that 1 to 1.5% range. And so it doesn't, you wouldn't think that would be a big deal until you think about really big numbers. And, in a country with 340 million people, then 1% of the people that get sick with this, and I don't know what the number is now, that let's say there have been 50 million people that have gotten COVID so far. So you do the math on that, and all of a sudden then you're sitting on a lot bigger number of people who are dying from that disease. Is that, 100 million would be a million people. So 50 million would be 500,000 people. So it doesn't make sense in terms of those numbers until you start thinking big and you start thinking in terms of a whole population. And then those 1% become someone's mom, someone's grandma, someone's child. And then those numbers become a lot more numerous and a lot more real. But thanks for asking the question. Okay, so deaths from the vaccine. So the last I looked, Jason, the number of deaths from the vaccine were, there were reactions from the vaccine, but actual deaths were actually really, really, really small, minuscule, nowhere near, as I was alluding to earlier in this broadcast, nowhere near the number of anywhere close to the number of deaths that we're actually seeing for people who have COVID. So I get it. Vaccines are not 100% foolproof. People have bad things happen to get vaccines. But if you're you're weighing the pros and cons of getting vaccinated versus getting sick with COVID, the numbers, the big numbers, once again, when you look at how many people have been vaccinated and how many of them are doing just fine from the standpoint that they were vaccinated versus the number of people that have had COVID and the number of people who walked away from that, the numbers definitely support getting vaccinated versus taking your chances on natural immunity. Natural immunity it's an option, but I just don't think it's a good one. But I thanks for asking the question. Can you tell us what ingredients are in the COVID vaccine? Yeah, I think if you pull up the product label, the FDA would have that, the company would have that. They're going to have what's in there. Once again, I've heard some concerns about what's in those vaccines. I don't know all the exact ingredients, but once again, those ingredients, whatever is in there, don't add up to the outcomes that we're seeing with people that get COVID. So I understand your concerns. Vaccines aren't perfect, but they're way more perfect than getting COVID. Yeah, why would the vaccine companies not have any recourse if a loved one dies? Yeah, I think that's a good question. We could flip it the other way in terms of people that are dying from COVID and folks who are saying that don't get vaccinated. There are a lot of bad outcomes from those, way more bad outcomes than people that get vaccinated. I don't know the details on how that works with companies when people have bad reactions and die from the vaccines. I don't. So thanks for asking the question. I just don't know the answer to that, Jason. My hunch is that lawsuits are going on with that. And then Kathy said, watching and working with patients struggling to get well and strong post-COVID is very heart-wrenching. It's very humbling. Yeah, thanks for that, Kathy. And so, yeah, it's not just people that die, but people that have been in the ICU or in the hospital for long periods of time on ventilators that have tracheostomies and those kind of things, they have a long path back. And so there are people that die, which is obviously the ultimate not turning back card, but people have their lives definitely altered from this virus, and it's sad. It saddens me. So Stephanie, so basically this virus shuts down the immune system, and those with illness makes it even harder to fight their illnesses they already have. Let me take this. So basically this virus shuts down the immune system, and those with illness makes it even harder to fight their illness they had. No, so the virus actually, the immune system does respond to the virus, whether you have a vaccine or not. Your immune system, and keep that up there because I kind of have to kind of think about all that. There's more in that question than just one thing. So our bodies, when we get exposed to any virus, our immune system responds to that. Just with this COVID virus, in some people, the immune system, number one, becomes overwhelmed by the viral load, so the amount of virus that's present, and then the body and the immune system can go haywire and cause this cascade of inflammation and cell destruction that ultimately leads to pneumonia and other complications and death. So no, the virus doesn't shut down the immune system; it just overwhelms it. And those with illness makes it even harder to fight their illness they already have. Yeah, I don't think that I don't. That's not how I see that. No, the illnesses that we already have, our immune systems are amazing, and they can still continue to. They fight. We have different antibodies for different illnesses that we've had in our bodies, or illnesses that we might have. And the immune system is a very intricate and very complicated thing that's going to be tough for me to go into great detail on here in this broadcast. I hope that helps somewhat with that question, Stephanie. My hunch is I'm not completely answering it for you, but it just gets into a lot of detail about that. But the vaccine and the virus are not they're going to stimulate the immune system. The immune system just gets overwhelmed by the viral load. Thank you so much for all those questions. I appreciate folks that are willing to throw things out there that they're thinking that concern them. That's what this is what this broadcast is about. I'm just trying to be transparent with you, and we as a hospital are trying to be transparent with you with the information that we have, and hope that helps as you think about navigating this pandemic. So thank you for all your questions. I hope information I share was helpful as well, and look forward to having another broadcast and any questions that you might have next week. Until then, be safe, and thanks for listening. Bye.